So that guy I met on eHarmony? Yeah. We're out together last night and I step off a curb and snap, heel breaks right off my shoe.
Oh no.
So I say, hell with it, take them off so I'm barefoot, and you'll never guess.
What?
He leans over, takes off his shoes and socks, and now we're both...
You're joking.
Amazing, right?
At eHarmony, you'll find someone you can be yourself with. Get who gets you on eHarmony. Sign up for eHarmony today.
Statistically speaking, cardiovascular disease is the most likely thing both to kill you and to make you stop living before you die. Knowing the most likely thing to cause the thing that is most likely to kill you can help you to decide what to deliberately put on autopilot in your daily life to drastically decrease your chances of becoming a statistic. So you're more able to help the people who need you most as you get older rather than the other way around. You're listening to the Health Courage Collective podcast, episode 178, Forward-Thinking Women Love Their Endothelium. Welcome to the Health Courage Collective podcast, the show for women who are too busy to slog through hours of generalized, inapplicable, and often contradictory health information, but too smart to ignore that a few minutes of focused attention now can prevent years of suffering in the future. I'm your host, Christina Hackett, a pharmacist who doesn't want you to live on prescriptions, a certified coach specifically trained to maximize your potential, and a compulsive learner obsessed with preventative, cutting-edge, holistic, and integrative medicine. I'm on a mission to increase your physical and mental resilience so you can fearlessly look forward to your next 40-plus limitless years. Your time is now. Let's go. Hey, welcome to another episode. I'm so happy that you're here today. If you are listening to this the day it comes out, tomorrow is Thanksgiving here in the US. It's also my oldest son's birthday. It's his second Thanksgiving Day birthday. He's turning 19, which I cannot wrap my head around. How is your envy? Were you able to see how it can be an asset that can help you to get to the end of your life having lived the life you actually wanted to live? What more could you ask for? Today, we're going to talk about a critically important part of your physiology. I think just knowing about it and thinking about caring for it will help you to put more years lived in good health into your future. So just a few weeks ago in episode 171, we talked about what smart women know about cholesterol. That episode pairs nicely with this one, so if you're interested in reducing your chances of dying or almost dying from the statistically most likely thing to kill you, episode 171 is a good place to start, and this episode is, in my opinion, a bigger lever to pull in reducing your risk of cardiovascular disease. But you do need to know about cholesterol too, especially because people talk about it so much, and being smarter than most of them is kind of awesome. Now that you know the real deal with cholesterol and what LDL and HDL are, which is not forms of cholesterol, and what is measured in standard blood tests, which is not anything helpful, it's good to know that probably the biggest driver of the development of life-threatening plaques in your arteries isn't the lipoprotein piece. If you remember, we have the lipoprotein piece, then the inflammation piece, and the endothelial health piece. We're going to talk about your endothelium today and its BFF, the glycocalyx. If your goal is to put more years lived in good health into your future, you need to be able to efficiently deliver nutrients to all of your vital organs and tissues. Your brain, your heart, your eyes, your kidneys, your liver, muscles, everything. Without the delivery of oxygen and nutrients to everything that keeps you alive and the removal of waste products, you die. With suboptimal delivery of oxygen and nutrients and everything that keeps you alive, and suboptimal removal of waste products, you slowly stop living. Years of teeny tiny unseen insults to your largest endocrine organ can get you perfectly teed up to have a catastrophic and or deadly event like a heart attack, stroke, angina, peripheral artery disease, coronary artery disease, kidney disease, insulin resistance, a life-threatening infection, and even cancer. So, what is your largest endocrine organ? It's guessing time. What weighs 5 times as much as your heart and can cover 6 tennis courts? It's not your largest endocrine gland, which is your thyroid, but your largest endocrine organ, which is your endothelium. You've probably heard of your epithelium before, which are cells that surround and form the barrier to the outside environment, like your skin and the lining of your intestines. The endothelium is a little bit different. Endothelium only lines your arteries, veins, capillaries, and lymphatic ducts. You can't see it or feel it, so why care about it? You'll never know it's screaming for help. I guess until you're suddenly almost dead, I guess. We talked about your lymphatic system way back in episode 26, and the endothelium that lines those ducts is also important. But if you don't have healthy arteries and veins, you don't have a healthy heart, brain, lungs, GI tract, liver, or anything really. And without healthy little capillaries, you won't have healthy eyes, brain, toes, or anything really. The health of your circulatory system affects the health of all other systems and organs in the body. One of the reasons, or probably the main reason people can feel so trashed after having COVID, is that it takes a while to repair your endothelium, which can get ravaged by COVID. In shocking ways, really. The coronavirus attacks your endothelium in a way that no other virus does. And your COVID case will be worse if your endothelium is struggling before you get infected. So one way to recover better from COVID is to get serious about loving your endothelium. And one way to prevent your future COVID case from being very serious is to get serious about loving your endothelium. But your love affair would still pay enormous dividends even if COVID didn't even exist, which some people think that it doesn't. Doesn't matter. A healthy endothelium makes your life better in every conceivable way. Well, it doesn't dust the top of your fridge, rotate your tires, or give you a vacation home in Prague, all of which would make my life better. But in every other way than just those three, it does. I promise. A healthy endothelium greatly reduces your risks of all cardiovascular diseases, cancer, diabetes, and Alzheimer's. A healthy endothelium improves the health of all of your organs and tissues because the endothelium is the connector that brings blood, oxygen, and nutrients to every cell in your body. Every cell in your body suffers if your endothelium is damaged. Endothelial cells are just a single little layer that lines the inside of blood vessels. When it's healthy, your endothelium is permeable enough to allow fluids to travel in between the cells to reach your tissues without being too permeable, which would allow toxins and other bad guys from getting into your cells. Way back in episode 9, we talked about nitric oxide. When it's healthy, your endothelium makes nitric oxide, which dilates your blood vessels to keep your blood pressure from getting too high, and it helps prevent the blood from clotting when it shouldn't. You probably know that atherosclerosis usually comes before a heart attack, ischemic stroke, and sometimes other types of blood clot-related deadly emergencies. Atherosclerosis, or that formation of plaque in your arteries, happens because of damage to your endothelium. Your damaged endothelium cries out, "Help, I'm hurt," so your immune system sends white blood cells and ramps up inflammation to heal that damage. The artery band-aid cholesterol comes along to try to smooth things out and patch up the damaged spot. Then more and more rescue molecules start loitering around and causing a plaque that grows with time and narrows your artery while creating a rough spot where clots can start to form. All of that deadly mess starts with endothelial damage. Damage to that tiny single layer of cells that lines the inside of your arteries. When the endothelium is healthy, it makes sure the inside of your vessels is a nice slip and slide with no crusty bits for things to stick to, and that can expand when needed, like when it's hot outside or your oxygen level is low because you're exercising. Dr. William Lee describes healthy endothelium like freshly Zambonied ice. Damaged endothelium is like a rink with scuffs in the ice. The skaters catch their blades and start falling down and piling up on top of each other. Don't let this happen to you. So what scuffs your endothelial ice? There are some genetic predispositions that you can find out whether you have if you get your DNA tested. If you had those, you would be wise to be extra careful about loving your endothelium. For everyone, high insulin levels are rough on your endothelium. High blood sugar is rough on your endothelium. Chronic inflammation is rough on your endothelium. High blood pressure is hard on your endothelium. An unfavorable cholesterol profile can be hard on your endothelium. This isn't high total cholesterol or even just high bad or LDL cholesterol. Remember from episode 171 that there's no such thing as bad cholesterol, and LDL isn't even cholesterol at all. But high amounts of ApoB particles and or high amounts of the extra sticky little bad guys, Lp(a) particles, those can be rough on your endothelium. And to be more accurate, there's an even cooler slip and slide that coats the coating of your blood vessels. It's called the glycocalyx. It's this slippery but sticky layer of polysaccharides and lipids, so fats with complex sugars, that's super, super, super thin, and it lays on top of this super, super thin endothelial layer. I think of it kind of like the slime I used to get in little plastic tubs when I was a kid in the 90s, soft and slippery, but sticky to itself enough that you can stretch it out really thin and be able to see through it. But it's also sticky enough that if you got it near your pencil eraser shavings or something at school, they would for sure get stuck in there. The insides of your blood vessels are lined with the endothelial cells, and the endothelial cells are lined with the glycocalyx slime stuff. It's the protector for the endothelium. It even contains a special mega antioxidant called superoxide dismutase, or SOD. That's really powerful stuff that you want to have around. The glycocalyx is part filter and part armor. There are also slightly different types of glycocalyx linings in the gut lining, the joints, the junctions between your nerves, the coatings over your nerves, on our eyeballs, and in our blood-brain barrier. According to cardiologist Dr. Stephen Gundry, cholesterol is almost never the cause of atherosclerosis or artery plaque. It's what gets trapped there trying to repair the damage to the glycocalyx and the endothelium. It's like spackle. Dr. Gundry also says that pretty much what always causes damage to your glycocalyx, either in your blood vessel walls or in your blood-brain barrier or in your joints or around your nerves, is proteins from wheat and things called LPSs that are fragments of dead bacteria, both of which get into your body if your intestinal tight junctions aren't tight enough. Most people's aren't. It's really hard to not have some degree of intestinal permeability in our modern world. So in addition to increased risk of cardiovascular disease from glycocalyx damage, we can have increased risk of joint pain, nerve disease, brain disease, and even dry eyes. Chronic inflammation is rough on your endothelium. Inflammation can come from a ton of sources. One major one is increased gut permeability, which allows more particles from your digestive system into your body than should have been able to get in, and freaking out your immune system. Smoking is also rough on your endothelium. Interestingly, straight up nicotine without anything else you find in tobacco or cigarettes or smoke or vape juice or anything is actually good for your endothelium, which is kind of weird. Physical inactivity is also rough on your endothelium. If you never get to a state of hypoxia from breathlessness or all of the other positive benefits of moving your body, you're guillotine choking your endothelium. Rude. There's something called vascular endothelial growth factor, or VEGF, that's like miracle grow for your endothelium. You want as much of it as you can get, and the best way you can get it to go up is when you experience a state of hypoxia or not getting enough oxygen for brief periods of time. Obviously, you have to get the dose right, but mostly we get that from exercising. So making sure you exercise to relative breathlessness regularly helps your endothelium so much. Not sleeping well wreaks havoc on your endothelium. Chronic unresolved stress damages your endothelium. Environmental toxins and a lot of other stressful things can also send harmful signals to your endothelium. I think understanding how critical your endothelial health is gives you a huge advantage. Unlike getting married or adopting a puppy, declaring your love for your endothelium doesn't require much more than an expanded understanding and acceptance of the fact that several things you do that are healthy for your body in other ways too are also healthy for your endothelium, which matters. Knowing how critical a healthy endothelium is for your longevity can help you determine which habits and behaviors to focus on. Lots and lots of things are good for you and good to do, but really only a basic few things significantly move the needle in multiple areas, and that's where I think you should spend your behavior design resources first. Kill 2 birds with one stone, or 10 birds with one stone, as the case may be. I guess we can't say that anymore because it's speciesist. Have you heard of this? In 2018, PETA announced that we need to remove speciesism from our language because it's hurtful to animals' feelings. So instead of saying kill 2 birds with one stone, you're supposed to say feed 2 birds with 1 scone. No more being the guinea pig, now you have to say be the test tube, which makes no sense because the test tube is not the medium on which the experiment is conducted, it's the container. Instead of saying bring home the bacon, you're supposed to say bring home the bagels. And instead of take the bull by the horns, you should say take the flower by the thorns. I do not want to be offensive, but I'm pretty sure that bagels and thorny flowers speak as much English as guinea pigs and bulls. So it seems like a lateral move to me, and I don't see how taking a flower by the thorns controls a potentially dangerous situation. But what do I know? So, what are the things that can feed 10 birds with 1 scone, which incidentally would be 10,000 times easier to do than actually killing 10 birds with 1 stone, at least at the same time? Anyone could easily feed more than 10 birds with 1 scone, so this is good. Let's go with it. First off, having a healthy working gut with tight junctions is probably the biggest thing you can do. We talked about some ways to do that in episodes 42, Is Leaky Gut Real? And just barely in episode 175 about emulsifiers in food. That's a multi-step process, but it reduces your risk of pretty much every chronic disease there is, and it also makes you look and feel better. And it keeps your endothelium and glycocalyx in tip-top shape, freshly Zamboni'd shape. If you want to know more about how to keep your tight junctions tight, send me a message at healthcouragecollective@gmail.com and we will talk about it. Eating lots of deeply colorful vegetables helps your endothelium stay happy, and it helps, but only if you have the correct gut bacteria to be able to use those polyphenols properly. Back to a healthy gut again, this time with a healthy microbiome. Eliminating or reducing sugar in your diet makes a huge difference for your endothelium, and it makes us super happy. It's also the best way to reduce your number of ApoB lipoprotein boats, or number of LDL particles, which reduces your chances that one will want to dock and deposit its cholesterol in your artery wall. Eliminating or reducing simple carbs and refined grains helps your endothelium in the exact same way. Getting enough sleep protects your endothelium. Finding healthy ways to manage stress protects your endothelium. Protecting your endothelial lining from high amounts of mechanical shear stress keeps your arteries healthy. Endothelial cells are, remember, it's just this tiny single cell layer. Endothelial cells are built to withstand mechanical force within a certain sweet spot range, but chronically high blood pressure can cause mechanical damage to the blood vessel walls, which then can start the cascade of wall thickening and cholesterol and white blood cell deposition, paving the road to a heart attack or a stroke. One of the best things you can do for your endothelium is one of the best things you can do for most systems of your body. Move. Movement is magic for all of your cells. Exercise is especially beneficial here, but non-exercise movement frequently throughout the day is also important. Exercise improves your resilience more than anything else you can do. I'm going to say that again. Exercise improves your endothelial resilience more than anything else you can do. If you're having some trouble falling in love with exercise, I have some ideas for you. Email me at healthcouragecollective@gmail.com and let's see what we can do to make the best thing you can do for your future self the thing you most enjoy doing right now. Besides reducing your consumption of sugar and simple carbohydrates, especially refined grains, and also reducing pro-inflammatory foods like industrial seed oils and anything deep fried, adding darkly pigmented foods, green leafy foods, and foods that have quercetin help your endothelium. Dark leafy foods help your body make more nitric oxide, which we talked about in episode 9, nitric oxide, and it's linked to blood vessel health. Quercetin is an antioxidant that actually also has a special job promoting the growth of endothelial stem cells into new, healthy baby endothelial cells. You can take it as a supplement, but it's also in food, and it was surprisingly hard to find a good list of quercetin foods in order of which ones have the most. But some quercetin-containing foods are capers, onions, kale, cherry tomatoes, broccoli, blueberries, apples, citrus fruits, parsley, sage, green tea, and elderberries. There's a supplement that also helps with the health of your glycocalyx and endothelium. It's pretty pricey, but I think it really works. I've never taken it personally, but I really do think it's a good one. It has even been shown to create regression of arterial plaques. That's a big deal. It has mostly been studied in people with cardiovascular disease, but a lot of cardiologists and healthcare professionals use it themselves and for their patients to prevent plaques from forming in the first place. It's called Arterisel. I'll put a link in the show notes if you're interested. I have no affiliation whatsoever with them, but I do think it's one of the best supplements you could take. I hope knowing more about your endothelium helps you to prevent things that could make you slowly stop living before you die. Remember that you want yours to be like freshly Zambonied ice. When it gets scratched up, it's like when you get a splinter in your skin. Your well-meaning immune system causes lots of inflammation to try to repair that damage. But that inflammation can cause the formation of dangerous plaques that could kill you. Your ApoB cholesterol transport particle numbers matter, but not quite as much as having a healthy endothelium matters. Cardiovascular disease is the most likely thing to kill you and the most likely chronic disease you will develop as you age. And the most likely cause of arteriosclerosis is having a less than stellar endothelium. You can protect yours with frequent movement, exercise that causes you to get out of breath, richly pigmented nutrient-dense foods, quercetin-containing foods, by keeping your insulin levels, your blood pressure, and your blood sugar in healthy ranges. Those are all hugely important, and there are ways to measure them, so don't neglect that. And also by keeping the tight junctions in your intestinal wall tight. That means falling in love with frequent movement and exercise and truly loving and enjoying non-packaged, minimally processed foods that are low in sugar and wheat. You can do that. You can totally do that. There are so many wonderful and easy options waiting for you to discover them. Let's get you to a place where the things that you most love to do are the things that are best for your endothelium. Then you can live more as you get older rather than less. Thank you so much for learning about your biggest endocrine organ today. It's a big deal, like for real. Next week, we're going to talk about an Italian indulgence that can help you put more years lived in good health into your future, partially because it's good for your endothelium. Until then, keep your endothelium freshly Zambonied and don't be normal. Thank you so much for tuning into the Health Courage Collective podcast. I am truly honored that you have paid me the enormous compliment of your time and attention. I would be so grateful if you would share this podcast with someone you know and subscribe so you never miss an episode. This podcast is for entertainment and information purposes only. Statements and views on this podcast are not medical advice. This podcast, including Christina Hackett and producers, disclaim responsibility for any possible adverse events by use of information contained herein. If you think you have a medical problem, consult a licensed physician.